how do I evaluate hormones in my practice? So lots of ways to look at hormones depending on who you're talking to and who the provider or who the physician you're listening to or the podcast. There's a few certain ways to do it. So you can look at blood levels, which are kind of the gold standard for the longest time. You can look at saliva levels and you can look at urine levels. So I kind of like to do a little bit of mix of all of it. So we look at a lot of serum or blood levels to look at your estradiol, progesterone, testosterone, free and total, sex hormone binding globulin, plus a couple others. We can also look at saliva testing and Dutch testing. So the urine testing is called the Dutch test. It's the one we use specifically. It stands for dried urine testing for comprehensive hormones. It looks at the metabolites of your urine. My gold star kind of way to look at hormones, or my favorite way to look at hormones, is using the Dutch test and a serum or saliva testing to see, okay, is she somebody who has a detox issue pathway, or what does the metabolites look like, so that we can really optimize your hormones full throttle.
Hi, Dr. Saxena here, Chief Medical Officer at Form Health. Thanks for visiting our channel. Make sure to subscribe to get the latest insights and information on functional and integrative medicine.